Welcome to this week's edition of the Medical Center Show. This week we have a really great show with Dr. Preston Hupart, the Chief of Interventional Cardiology at Jersey City Medical Center. We'll be right back.
Newport, the luxury waterfront community on the Hudson River, offers the quality of life you deserve in 10 high-rise rental towers with amenities such as the on-site Newport Path subway, light rail and ferry service, Newport Town Square, 3 playgrounds, dog run, upscale restaurants, retail giants like Sears, JCPenney, Macy's, and Target. Morton Williams Supermarket is just outside your front door. A health and fitness club, spa, skating rink, and medical facilities are also on site. NewportNJ.com. Enjoy the New York skyline from Newport Town Square. Manhattan is just one path stop away or quick ride through the Holland Tunnel. Nursery and private elementary schools all on site. 12-screen movie theater at the Newport Center Mall. Want to visit Newport? Stay at the Westin or Marriott Hotel. Go to NewportNJ.com for details. Newport has luxurious towers, great restaurants, shopping, New York skyline views, schools, playgrounds, a marina and yacht club, gym, spa, fine wine, fine living. It's incredible. It's you. NewportNJ.com. Newport, live like you want.
Seeing the ER doctor at the Jersey City Medical Center has never been easier. If you're sick, you just click. Go to libertyhealth.org, and here's how it works. Click Skip the Wait. Select your time and check in now. Enter your symptoms, your personal information. Click Proceed to Confirmation, and the doctor's waiting for you. The Jersey City Medical Center. Make Hudson County's #1 hospital your first choice. Jersey City Medical Center consistently receives the highest hospital ranking and ratings in New Jersey. #1 overall hospital in the state. #1 for high-risk pregnancy. #1 for neurological disorders. #1 for stroke. Magnet Award for nursing excellence. A for hospital safety. What makes the Jersey City Medical Center the #1 hospital in the state? Top-rated, award-winning medical professionals you can see today at the Jersey City Medical Center. Make the #1 hospital your first choice, the Jersey City Medical Center.
Welcome back, everybody. Today we have Dr. Preston Hupart, who is the Chief of Interventional Cardiology at Jersey City Medical Center. Dr. Hupart, tell us a little bit about your education, training. You know, you're one of those New York guys, right?
Yes, I am. Pleasure to be here today. Thanks for inviting me.
Okay.
Born and raised in Brooklyn, New York.
Oh, there you go.
Relatively local, so yes, one of the New York guys.
Mm-hmm.
I did most of my higher education out in Long Island. I did my undergraduate work at State University of New York at Stony Brook.
Okay.
Medical school was at the New York College of Osteopathic Medicine in Old Westbury, Long Island.
Okay.
Following that, my postgraduate training primarily at Beth Israel Medical Center in New York.
Okay.
Did my internal medicine residency over there, 3 years. Chose to specialize in cardiology. 3 years of cardiology fellowship, and chose to subspecialize in interventional cardiology, again doing it at Beth Israel.
Okay.
Following Beth Israel, after all that training, those years, needed to pay back the student loans, took a job in Jersey City.
Okay, great.
Joined my current partners and been with them for the past 18 years.
And your current partners are part of Total Cardiology Care?
Total Cardiology Care, yes.
And where are they located?
We're located a few blocks north of here. We're here in the Jersey City Heights, 120 Franklin Street.
Okay.
Spend a lot of time down at the Jersey City Medical Center, of course.
Right.
That's right.
And then we've got a new location, right, that you're going into over in Paulus Hook?
Absolutely. We have other sites. Primarily was here on Franklin Street, but yes,
Right.
we are in Paulus Hook, Warren Street. Warren
Okay,
Street, yes.
great, on Warren Street in Paulus Hook, great.
Yes, absolutely.
So let's talk a little bit about interventional cardiology. I'm sure most people don't even understand what that is. So tell us a little about your directorship roles and kind of what you do as an interventional cardiologist.
Great question. Director of the Cardiac Cath Lab. Many aspects to my job in the Cath Lab. My job is to oversee, to make sure that the patient's experiences has a wonderful experience coming to the lab. They're at the most vulnerable, when they come in for their cardiac procedures. I'm involved in the credentialing process for the doctors, make sure that their training is appropriate to do the procedures that they're doing on their patients, make sure that they remain current. Mm-hmm. I'm involved in the staffing, nurses, technologists, and other ancillary staff. Quality, we have to keep an eye on that, and I review all the cases. I'm sort of a Cath Lab, crazy
Quality.
guy. Or,
Good.
well, I go
The
home.
quality
people,
guru?
I guess. I don't know. People go home at night and they play with the kids and then they turn on the TV. I turn on the computer and I go into the Cath Lab computer and I basically look at the day's work when if I'm not there, reviewing all the cases. Of course, we're a teaching program and we have residents, medical students, nursing students, EMTs, pharmacy students, all rotate through the Cath Lab. And I think that one of my most important roles is to just remain current, see what's out in the latest literature, and making sure that we bring the most up-to-date technology to our hospital to make sure that our community is best served.
Right.
Yes.
Well, we are the only hospital in Hudson County that does open heart surgery.
Absolutely.
We actually just added electrophysiology to our Cath Lab, so we really have a comprehensive cardiac program.
Absolutely. We're a tertiary facility, the only one.
So tell everybody what tertiary means, because I don't think they know what that means.
There are a lot of hospitals in the region that don't offer the services as you just mentioned.
Right.
Being a tertiary, we're a referral center.
Right.
Someone needs bypass surgery, they can't have it at their local hospital, they'll need to come to us.
Right.
For a lot of elective cath procedures, they'll need to come to us because we have so many more things that we can offer.
Okay.
There are certain hospitals that the smaller hospitals, you might be able to do some emergency angioplasty procedures. Few hospitals you can do some electively, but they don't have a lot of the latest technology that we currently have.
Okay. So really, we have state-of-the-art technology. We've got a comprehensive cardiac program that includes open heart surgery, cardiac catheterization, interventional cardiology. I mean, we really do a great job of getting people who have chest pain from our ER to the Cath Lab in record time, right?
We do a fantastic job. It's a lot of hard work because there are a lot of moving parts. We depend upon our ambulances, our EMTs. They do a fantastic job. We have a lot of early notice.
Right.
We have a system where the electrocardiograms, which a lot of the decision making is based upon the EKG.
So let's talk about that for a minute. So our emergency medical service, those are the ambulances that are in the community.
Yes.
When they pick up somebody who's got chest pain, they can immediately do an EKG and that gets transmitted to the hospital?
Absolutely.
Wow.
It goes right to the emergency department.
Right.
Technology is wonderful. My cell phone goes off. I'm looking at an EKG wherever I'm at.
You can see the EKG on your cell phone
I
even?
can see the EKG on my cell phone.
That's great.
And blow it up for my 50-year-old eyes. Get them up.
So that's why coordinating between EMS, the hospital, especially when you have something like chest pain, is so important.
Absolutely. The coordination is of utmost importance.
Right.
When someone's having a heart attack, life and death,
Right.
the sooner you act, the better the patient does.
Right.
We take it very seriously. We're meeting on a regular basis. Just had a meeting the other day. I'm meeting weekly with many of the staff members. Talk with the emergency department on a regular basis to make sure that we continue to fine-tune the process.
Right.
Yes.
Because the key is, once you identify somebody, they have to get to the Cath Lab within 90 minutes?
In our training, they teach us time is muscle.
Right.
When the artery is closed and you're having a heart attack.
Okay, so let's go back for a minute. So time is muscle.
Time is muscle.
People have chest pain because...
There is an abrupt closure of a
Right.
coronary artery. The coronary arteries supply blood, oxygen to the living
And there's
heart
an
muscle.
abrupt closure because it's clotted or a spasm, or what's the reason?
They're generally the most common. There are several forms of, there's a universal definition of a heart attack.
Right.
Type 1, the more common one, we'll stick with that.
Right.
There's a plaque, and a plaque may rupture. And that ruptured plaque, anything can trigger that.
All right.
Nicotine, stress, so many different triggers. Once there is a rupture of that plaque, that attracts all the blood elements, platelets, red blood cells, develops a clot. The clot will then block the artery, and then there'll be no flow to the heart.
So then everything beyond that block is like dead tissue almost, because
Well, it's not
blood,
dead.
Right?
It's vulnerable. It's at risk.
Right.
And so you have time. There's the 90 minutes.
Right.
The sooner you open it, if it happens to happen within moments,
Right.
you open it up, there'll be very little damage. The
Right.
longer that there's no blood flow, the more damage that will be done.
Wow.
So wave-like and layers of the heart, you're losing it until all of it will be infarcted.
So that's why it's so important that we coordinate the EMS with the hospital and the Cath Lab. So the second somebody has chest pain and they meet that criteria, we got to get them to the Cath Lab as soon as possible.
Yes.
So
Yes.
time is muscle.
Time is muscle. Thankfully, we're very good at this. We have a team in place, our doctors, nurses, mind you, this could happen at 2, 3 o'clock in the morning
Sure.
in the middle of a deep sleep.
Right.
So it's quick brush of the teeth and off in the car, and you head to the hospital. And we have, while we're doing that, the emergency department is prepping the patient,
Right.
Right medications, getting everything in place for us. Often I'm walking right into the cath lab and I'm ready to perk the groin and
Wow.
get the process moving.
Okay,
And
great.
within minutes of arrival, the balloon is up.
Okay. We'll be right back with Dr. Preston Newport.
Jersey City Medical Center, Hudson County's #1 hospital, as ranked by U.S. News and World Report. Hudson County's only hospital to receive an A safety score rating. Jersey City Medical Center is Hudson County's only hospital to receive the prestigious Magnet Award for Nursing Excellence. Make the #1 hospital in Hudson County your first choice for quality health care. Jersey City Medical Center. Visit us on the web at libertyhealth.org. Jersey City Medical Center, Hudson County's #1 hospital, as ranked by the U.S. News and World Report. Why? Because of its patient care, not its bottom line. Jersey City Medical Center, for patients, not for profit. The Jersey City Medical Center accepts all patients and most insurance. At the Jersey City Medical Center, your health is our concern, not our bottom line. Make Hudson County's #1 hospital your first choice. The Jersey City Medical Center, for patients, not for profit. Visit us on the web at libertyhealth.org.
Welcome back. I'm here with Dr. Hupart, the Chief of Interventional Cardiology and the Chief of our Cath Lab at Jersey City Medical Center. So we talked about how important it is to get somebody from the ambulance to the Cath Lab. And the standard is get them there within 90 minutes.
That's the standard.
Right.
Yes.
So, and that coordination with EMS and the emergency department and the Cath Lab is so important. And we really do that very, very well.
Yes.
Tell me, so now the patient's in the Cath Lab, right?
Yes.
And you have to get a catheter to their heart.
Yes.
That's the interventional cardiology piece. How does that happen? And tell us a little bit about that.
We need to get to the heart. So
Right.
we have to enter the arterial system. There are
Okay.
several sites. Predominantly, we're using the femoral arteries in the groin. You
Okay,
can
so
do,
in the leg. That's
in the
why
leg, in the
after they
groin.
have a cardiac cath,
Yes.
they have that wound and everything they have to take care of afterwards, right?
Well, not much of a wound.
Okay,
Not
good,
much of a wound.
good.
A little percutaneous, and
Okay.
no sutures involved.
All right,
No
good.
bandages involved.
Okay,
We're
great.
able to actually close the wound at
Oh,
the
good.
very end with a little plug or a suture device,
Good.
where people can be up and around in a matter of shortly, hour and a half.
Oh, great.
Yeah.
Okay.
So it's not a major wound, but yes,
Okay.
interventional cardiology. We need, in that particular case, in the acute MI heart attack, we need to open up the artery.
Okay.
So there are diagnostic procedures where you're passing a catheter from an arm, a wrist, a brachial artery, or the femoral artery to the heart to identify, to look at the arteries, inject some dye, and to see what the landscape is. See
Okay.
if there's
So you take a catheter from their groin, it goes all the way up into the heart.
2 seconds.
2 seconds?
Well,
Wow.
unless there's
You must be really good at it.
very good at it.
Okay.
It's generally of course, there's all kinds of people out there that can have aortic problems.
Sure.
But in people that have normal anatomy, from the femoral artery up the aorta to the heart, it's really just a few seconds to get there.
Wow.
It's all done under X-ray. It's all done. You track a catheter. You do not want to cause any damage.
Right.
Everything is tracked over a J-tipped guide wire. So we're just following the guide wire under the X-ray machine, following our catheters over the wire to make sure that it's placed in the appropriate spot.
Okay.
A diagnostic cath, an angiogram, shows us the landscape, shows us we inject dye into the arteries and we see what's going on, where is there an occlusion, where is there a blockage or a tight stenosis.
Okay.
The interventionalist is someone who can act on that. There are invasive doctors that just do the invasive work, but an interventionalist can do the fixing.
Okay, so let's talk about that for a minute. So you're an interventional cardiologist. You
Yes.
take that catheter, you put it into somebody's heart. Once that happens and you see a stenosis, meaning a narrowing of the artery, or you see a blockage, you use that catheter to unblock that, right?
Well, I use the catheter as a way to unblock it. It's given me a passageway. That catheter stays at the beginning of the artery,
Right.
and through that catheter, I'm able to direct a guide wire
Okay.
across the blockage,
Right.
and then I'm able to track different types of equipment, whether it's a clot removal device,
Right.
a balloon, a stent. It's all tracked over the guide wire.
Okay,
So
so-
the first catheter stays at the
All
artery.
right, so let's talk about clot removal device. How's that work?
Pretty simple. You have to cross the blockage with a wire. Everything is tracked over the wire. The removal device will track over the wire when it's like a spoon, and basically you approach the blockage where the clot is, and you're able to aspirate back on a syringe and actually suck the clot out through a catheter.
So the clot actually comes out at the end of the catheter?
Clot comes out at the end of the catheter.
Wow.
There are other devices that can also be used, but in an acute heart attack, time is of the essence. Sometimes you may just balloon, other times you may want to remove the clots.
Okay.
In an elective case, less of the removal, it's often heart plaque and not a clot involved, and more of the balloon and stenting.
Okay. Now, the balloon. The balloon's at the end of this thing, and
Yes,
that's just you blow the balloon up, and that, I don't know. You tell us how that works.
It's fascinating. You
is,
know,
sure.
we do it. It's
We're going to try to
second-
get some pictures, right? And
Absolutely,
show people the
we'll
pictures.
get pictures
Yeah.
up there.
Okay, good.
It's fascinating stuff, but we do it at second nature.
Right.
We track the balloon over wire. It's all done under X-ray, and I have these television monitors in front of me. The balloons have markers, so I know exactly. I asked for a length of the balloon, and I have markers, so I could measure the length of the blockage to choose the appropriate equipment. There are also sizes of the balloons, and we're able to approximate the size of the artery, and then we choose the balloon. So we track it over the wire, we put it in place, we have these radio-opaque markers that we can see under the X-ray, and we're able to pretty much determine the length. We blow it up. We have a device where we just inflate the balloon, take the balloon down, and we see what we have afterwards.
And
similarly, when we have our stents, it's
Okay.
delivered on a balloon.
So a stent is just a narrow catheter? Is that what that is? Or it's a
Stent is a
little
very,
tube?
it's like the balloon, it's the same equipment as the balloon.
Okay.
It's on a catheter, it's on the tip of a catheter that travels over a wire.
Right.
The difference is that there is a slotted tube, a metal tube, that's crimped on the balloon.
Right.
So in a balloon angioplasty, you're inflating the balloon and you're deflating, removing it.
I
In
see.
a stent procedure, you're inflating the balloon, deflating, leaving behind a scaffold.
Oh.
So you have a metal stent in there in the artery, which is now behind. The body will take care of it, will endothelialize it, develop
Right.
a skin layer, and it becomes part of the wall of the artery.
And so when that happens, the blood flow then goes through those stents and patient feels better?
Immediately.
Do they'll feel like the chest pain go away?
In the setting of an acute heart attack, absolutely. There are cases where people they have a cardiac arrest. Suddenly, everything stabilizes once you establish blood flow.
Wow.
Suddenly, you achieve a normal rhythm. In
Yeah.
someone who is having severe pain, within seconds, their pain has resolved.
Wow.
You can see the changes on the EKG coming back, blood pressure recurring immediately. The heart likes blood flow.
Likes
Yeah,
blood flow.
it likes
so
blood flow.
So the key is get that blood flow
I
done
can't stress the importance
as
of that.
soon as
Absolutely.
possible.
As soon as possible.
Somebody's sitting at home, they're feeling chest pain, get to the ER so we can get you to the Cath Lab.
I got to tell you,
Open up
that's the most important thing that's been said so far, because so many people will sit there and say, well, I have a little indigestion.
Right.
Well, you know what? Big deal if it's indigestion and you went to the ER.
Right.
Big deal.
Right.
You know, if it's a heart attack, got
Right.
to know as soon as possible.
Right.
Yeah. Most important thing
Right.
you said.
Now, I know a lot of people know this because they've had these kinds of procedures, but the new stents, and maybe we can talk a little bit about technology, but
Sure.
some of the stents actually have drugs,
Medications.
medications in them?
Yeah. The technology is amazing.
Right.
I feel very fortunate about the time that I trained in cardiology and in interventional cardiology, because I saw what it was like before stents.
Right.
I trained the first year that stents were available, and now the stents that we are using are just remarkable. We're able to get into places that we couldn't before. They were very rigid before.
Right.
Now the drug-eluting stents, once you put a stent in and you open up an artery, the body will have a healing process. And
Okay, hold that thought. We'll be right back with
Sure.
Dr. Hupart.
It takes more than a state-of-the-art medical facility to make a great hospital. It takes a team of dedicated medical professionals. That's the Jersey City Medical Center, Hudson County's #1 hospital. Medical teams consisting of New Jersey's top doctors, Magnet Award-winning nurses, and accomplished hospital associates, all committed to your good health. That's what you have at the Jersey City Medical Center. Make Hudson County's #1 hospital your first choice. The Jersey City Medical Center. On the web at libertyhealth.org.
Panapinto Properties, Jersey City. Shaping the workplace with state-of-the-art office space and an address your company desires. Building residences that define your home environment. Adjacent to all modes of transportation. On-site parking available. The right address, the right lease. 201-521-9000 or visit on the web at panapintoproperties.com. Panapinto Properties, building Jersey City for everyone.
Seeing the ER doctor at the Jersey City Medical Center has never been easier. If you're sick, you just click. Go to libertyhealth.org, and here's how it works. Click Skip the Wait. Select your time and check in now. Enter your symptoms, your personal information. Click Proceed to Confirmation, and the doctor's waiting for you. The Jersey City Medical Center. Make Hudson County's #1 hospital your first choice.
Welcome back. We're here with Dr. Preston Hupart, the chief of our cardiac cath lab and interventional cardiologist. Preston, we were talking about drug-eluting stents, and I know
Yes, we were.
because that's something that's probably in the last couple of years become a big deal.
Very big deal.
Okay,
Very
so
big deal.
tell us a little about these stents and why they're important and what they do for us.
Stenting is wonderful with the bare metal stents.
Right.
But the problem with stenting is, and anything in medicine, anything in life, nothing is perfect.
Right.
Our body will heal after we put these stents in. They'll develop some scarring. The problem is you may not be able to stop that trigger of scarring.
Okay.
So we have these medications that are impregnated into the metal stents. And what that basically does is we'll stop the cell growth and try to help prevent restenosis, reocclusion within the stent.
Okay.
And so the new medications are just absolutely wonderful. Drug-eluting stenting, putting a lot of surgeons out of business because they're working out so well.
Well,
which is,
It's better to
It
have
is what it
something
is.
less invasive than having open heart surgery, obviously.
well, what's better? It's better to have something, it's better to have open heart surgery when you need open heart
Right.
surgery. There's absolutely a tremendous place for our surgeons. This just allows us to be more flexible in helping people.
Okay.
All the technologies are wonderful. We just have to know how to apply them.
Right. So tell us about some other new technologies that we have at the medical center in our cath lab.
Sure, sure. After becoming director, I keep an eye on every new technology that's out there and see what's most important, what will help our community. In the past year or two, we brought in 2 new devices. One device is called the Impella device. It's a very important device. It's actually a left ventricular assist device.
Oh,
It's
okay.
allowing us to take care of some of our sickest patients. And it also allows us to do very high-risk coronary interventions. The other technology we brought in, it's called FFR, Fractional Flow Reserve, and I like that a lot because it helps guide us in doing the appropriate thing.
Okay.
We have many patients that have severe lesions. We understand that they need to be intervened on. And of course, when you don't, you leave alone. There are these moderate lesions where we're actually able to test the lesion and test the physiology. So we can look at the anatomy and then we can look at the physiology and place the 2 together to make sure that we're doing the correct thing for the patient.
Okay, great.
So the Impella device is wonderful, if I may go back to that.
No, yeah, because tell us kind of what that Impella device does.
It's great. It's just wonderful. You have patients that may be in cardiogenic shock. Their heart cannot deliver enough blood flow to maintain normal body function. And they may need a heart transplant, heart surgery. And this is a device that, from the groin, place it to the heart, where it will act, and it will be connected to an external motor. And it will allow for blood to exit the left ventricle, which is the big pumping chamber of the heart,
Right.
to the aorta, where it will do the work of the heart. It will deliver cardiac output, blood flow to the rest of the body. So we can use it as a temporizing measure to get that person what he needs, whether it's a new heart, whether it's bypass surgery, heart surgery, valve surgery, or a more permanent assist device. I think there's a whole group of other patients that may benefit from it. If we identify a patient who is extremely high risk and they require coronary intervention, but they have severe heart muscle dysfunction, low blood pressure, severe coronary anatomy, they may be living off of one artery and that artery has a 90% blockage. It's a very useful tool in order to help make that procedure go as safely as possible.
Okay.
The first